Most of the time, a root canal is required when there's a deep filling, when there's a large cavity that's gone into the nerve, or deep filling close to the nerve, or even when there's a crack that gets into the nerve. And we've seen a lot of these fractures due to COVID. The stress, the clenching, the grinding goes up. So when this crack or this cavity goes into the nerve starts getting inflamed, and that's what causes pain. When it's left, it turns into an infection around the tooth. And sometimes it can actually skip that phase and go right to an infection. The purpose of a root canal is just like filling a tooth. You have a hole in the middle of a tooth. We have to fill that tooth up. But what a root canal is we're filling the roots of the tooth. So no portion of the tooth is removed. The tooth is left intact. We just clean the inside part of the roots out, and that's where the nerve sits. That's where the pain is coming from. Once it's cleaned out, we fill the root with the material, and then we fill the tooth back up. The great thing about a root canal is you get to keep your tooth, and it's pain-free, it's well frozen, with great techniques that we have nowadays. This fear and anxiety really should be a thing of the past. It does take a little bit longer of a procedure. It can be anywhere from 30 minutes to an hour and a half, depending on the size of the tooth. The downside is that it does make the tooth weaker. A root canal needs a crown, and a crown is a cap that goes over the tooth to protect it. So a root canal and a crown go hand in hand. And the benefit is you get to keep the tooth that allows you to function on it, eat on it, and smile with it. If you have any of these concerns or questions, we're happy to see you at our office. Please contact us for a complimentary consultation.